Welcome to my YouTube channel. If you have not subscribed my channel yet, please subscribe it now. Today we are going to see the rationales that will help you answer multiple choice questions and ensure safe nursing practice. We will be dealing with psychiatry today. First of all, people who smoke metabolize clozapine faster than who do not smoke. This is due to the aromatic hydrocarbons in the cigarette smoke. It is not due to the nicotine. Therefore, if a person taking clozapine stops smoking, their clozapine levels can become elevated, leading to adverse side effects such as seizures. Some evidence suggests that a 50% increase in clozapine levels may occur within 2 to 4 weeks of smoking cessation. Alternatively, if a patient begins smoking during treatment, clozapine levels may decrease and therapeutic effect may be compromised, requiring an increase in the dose of clozapine. Second one, lithium, a commonly used medicine to treat bipolar disorder and mania, has been associated with an increased risk of Epstein's anomaly, a congenital malformation of the heart in infants when taken early in pregnancy. Epstein's anomaly is a rare heart defect that's present at birth. It is congenital. In this condition, the infant's tricuspid valve is in the wrong position, and the valve's flaps, that means the leaflets, are in the incorrect shape. As a result, the valve does not work properly. When giving a group of antidepressants like SSRIs, the selective serotonin reuptake inhibitors, to patients, monitor vital signs because SSRIs can potentially lower or increase blood pressure. Teach a client taking monoamine oxidase inhibitors about food items that contain tyramine because tyramine-rich diet can potentiate hypertensive crisis in patients taking monoamine oxidase inhibitors. So keep the antidote phenethylamine injection in hand. Examples of tyramine-rich food items are strong or aged cheeses, blue cheeses, meats treated with salt and nitrate or nitrite, such as dry type summer sausages, pepperoni, and salami. Some overripe fruits or beef, if they take these food items, it can cause serious troubles like hypertensive crisis. Do not argue with a schizophrenic client's beliefs or try to convince the client that the delusions are false or unreal. This is because arguing will only increase client's defensive position, thereby reinforcing false beliefs. This will result in the clients feeling even more isolated and misunderstood. Only smaller doses of psychiatric medication should be administered to elderly patients because of the susceptibility of developing side effects, as the medicines metabolize and secrete from their body more slowly than a younger adult. White blood cell count should be checked weekly till 18 weeks and then monthly for clients started on clozapine because clozapine can cause a granulocytosis. While talking to a client with schizophrenia, keep voice in a low manner and speak slowly as much as possible because a high pitched or loud tone of voice can elevate anxiety levels while slow speaking aids understanding. Alcohol should be restricted during pregnancy due to the risk of developing fetal alcohol syndrome. Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but the defects caused by fetal alcohol syndrome are not reversible. Monitor serum sodium levels of patients receiving sertraline because hyponatremia, that is a low sodium level in blood, is a side effect of sertraline. Electrolyte abnormalities are frequently seen in eating disorders associated with purging behaviors. Therefore, blood electrolyte levels must be checked routinely. Hypokalemia can lead to disturbances in heart rhythm. Meanwhile, hyponatremia can alter cognitive functions. If you want to stop taking antidepressants, it is important to talk to your doctor about tapering your dosage down to zero just because instead of abruptly stopping your medication. It's because this will help you avoid symptoms of withdrawal. Wernicke's encephalopathy and Korsakoff psychosis are complications of deficiency of thiamine, vitamin B1, due to alcoholism. Therefore, to prevent these conditions, thiamine should be administered to clients who are alcoholic. Thyroid function tests should be done while a client is on antipsychotic medications, especially olanzapine and quetiapine, because these antipsychotics can alter thyroid functioning, especially an alteration in the T4 levels. Blood levels of lithium should be monitored after treatment has begun and then after every dosage change if there are signs of toxicity or mood changes. Blood levels are often done 5 days after a dosage change and it takes some time for the levels to stabilize. Lithium is associated with a number of renal adverse effects, including nephrogenic diabetes insipidus, which affects up to 40% of the patients who take lithium, chronic kidney disease, and renal failure. Therefore, renal function tests must be performed routinely for patients receiving lithium. Alcohol withdrawal delirium is a medical emergency because death can occur from myocardial infarction, fat emboli, peripheral vascular disease, peripheral vascular collapse, electrolyte imbalance, aspiration pneumonia, or suicide. Instruct a client on disulfiram, which is an antabuse drug, to avoid the use of alcohol or alcohol-containing substances like aftershave lotions, body sprays, etc., to prevent a serious life-threatening condition called a ethanol disulfiram reaction that can lead even to the death of the person. As an alternative to treat insomnia, use antihistamines like promethazine to benzodiazepines because benzodiazepines can cause dependence and promethazine does not. For example, for benzodiazepine is diazepam, clonazepam, lorazepam, and all. Avoid taking carbamazepine and valproic acid in pregnancy because it can increase the risk of developing neural tube defects in a fetus. Antipsychotics should be taken with caution because of its side effects called extrapyramidal symptoms, including neuroleptic induced Parkinsonism, akathisia, tardive dyskinesia, neuroleptic malignant syndrome, and acute dystonia. Rivastigmine, a drug of choice in Alzheimer's disease, should be administered with caution to patients with peptic ulcer disease, bradycardia, sick sinus syndrome, which is also called as tachybrady syndrome, urinary obstruction, and lung diseases because it can enhance cholinergic transmission, intensifying the symptoms of these disorders. Galantamine, a drug of choice in Alzheimer's disease, should be administered with caution to patients with COPD, chronic obstructive pulmonary disease, and asthma because the drug can cause bronchoconstriction. Taking the antidepressant drug venlafaxine during pregnancy may increase your risk of having a baby with a birth defect. Recent studies have specifically linked venlafaxine to an increased risk of cleft palate. Unfortunately, many women were not aware of this risk when they decided to take Effexor. Effexor is the trade name of venlafaxine during pregnancy. CT scanning of brain of clients who have increased prolactin level due to antipsychotic drug use is recommended. This is to identify whether the increased prolactin levels in the blood is due to the presence of prolactin secreting tumor or is it a side effect of the antipsychotic drug. Grapefruit and grapefruit juice may interact with certain benzodiazepines such as midazolam, triazolam, and alprazolam. Blood levels of these drugs may be increased if taken after drinking grapefruit juice, and lead to potentially dangerous side effects. Patients receiving selective serotonin reuptake inhibitors should be asked about their sexual history. Common side effects include decreased libido and difficulty getting an erection. Clients taking antidepressants also report delayed or blocked orgasm. Avoid touching a schizophrenic client because touch by an unknown person can be misinterpreted as a sexual or threatening gesture. This is particularly true for a paranoid client. Teach the client and family the warning symptoms of relapse because rapid recognition of early warning symptoms can help ward off potential relapse when immediate medical attention is sought. Electroconvulsive therapy should not be administered to people with pacemakers as ECT would interfere with the pacemaker's functioning. Theophylline should be discontinued before electroconvulsive therapy because it can increase seizure duration and result in status epilepticus. Status epilepticus is a condition where the epilepsy will not respond to any type of treatment. For clients with somatoform disorders, complaints regarding physical illness that are not actually present, Allow a specific time period for the client to discuss physical compliance because the client will feel less threatened if this behavior is limited rather than stopped completely. Avoid responding with positive reinforcement about the physical compliance. Do not whisper or laugh in front of a client with a paranoid disorders because he or she would think that you are talking about him or her or laughing at him or her. That can increase his or her paranoia. Sedative drugs are contraindicated in patients with chronic obstructive pulmonary disease due to its effect on suppression of respiration. Beta blockers, example metoprolol, should not be administered before electroconvulsive therapy because ECT can enhance bradycardia and precipitate asystole. While engaging with the schizophrenic clients, maintain low level of stimuli and enhance a non-threatening environment. Avoid groups especially because noisy environments might be perceived as threatening. When SSRIs, selective serotonin reuptake inhibitors, are given with monoamine oxidase inhibitors, there is a risk of developing serotonin syndrome characterized by elevated temperature, muscle rigidity, and elevated creatine phosphokinase levels. Lidocaine and its analogues should be withheld before ECT because it can interfere with the seizure reduction. Do not take alcohol when you are on olanzapine injection because the medication could worsen the effects of alcohol. Advise clients to wake up from bed slowly during the initial titration of clozapine because of the risk of falls due to orthostatic hypotension. Instruct the client taking lithium to drink at least 6 glasses of water a day and adequate intake of salt because hyponatremia potentiates lithium toxicity. Monitor a depressed client closely for signs of suicidal ideation. If the client presents with increased energy, monitor closely because it could mean that the client has now the energy to perform the suicidal act. When administering benzodiazepines, have flumazenil on hand because it is the antidote of benzodiazepines. Avoid contact with the liquid preparations of antipsychotic medications because of the risk of contact dermatitis. ECG should be performed routinely for patients receiving antipsychotic medications because antipsychotics increase risk of QT prolongation in ECG. Look for evidence of cardiac failure with clozapine as it is associated with an increased risk of myocarditis. It is important to look at the pupils of an intoxicated person because meiosis pinpoint pupil is an indication of opioid overdose. Have naloxone with you as it is the antidote of opioid overdose. Take caution while taking psychiatric drugs during lactation as most of these drugs are secreted in breast milk. Patients with seizure disorders should not be given with bupropion, maprotilene, or chlorpromazine because these medications would lower seizure threshold. Monitor body weight of patients receiving olanzapine or valproic acids because these medications cause insulin resistance and increase body weight. Benzodiazepines and anticonvulsants should be reduced before ECT because it would interfere with seizure activity. Do not drive or operate any machinery after taking olanzapine injection because it may cause drowsiness in some people and can cause accidents. Please subscribe and share my channel if you have not done it yet. Thank you.